Parents tell me every week that they've been to specialists, they've run blood tests, and nobody can understand why their child's actually struggling. The blood work comes back normal, the MRIs show nothing, the EEGs are clear, and yet your child is still dealing with chronic ear infections, speech delays, sensory meltdowns, focusing challenges, sleep struggles that really will not stop. Here's what's happening in traditional pediatric medicine is that they're looking for pathology and disease. They're asking, is something seriously wrong? But they're completely missing the most important question, which is how well the nervous system is actually functioning. Your pediatrician tracks your child's height and weight at every visit. But what about the system that controls digestion, immunity, sleep, movement, behavior, emotions, or development? The child's nervous system is their air traffic controller for every organ, muscle, and tissue in the body. We use scanning technology called the Insight scans, and they help thousands of families understand why their childs are actually having health challenges. This video today is for you parents who are exhausted from collecting diagnosis without getting any real solutions. Parents who have been told that they're going to grow out of it. Don't worry, just watch and wait. When you know deep down something needs to change with your child's health. This is for families who are ready to understand what's actually causing those particular challenges within your child. Today you're going to discover why traditional pediatric evaluations miss a very important critical piece of the puzzle. You're going to learn about the different scans that we use to measure this nervous system dysfunction, what a raging bull or a drunken bull pattern actually means for your child, and why this objective data really changes the actual approach to getting them real answers and real progress and improvement. We're going to start with a practice member, a little boy named Braxton. At just 1 week old, his parents were told that their beautiful little baby boy needed to be evaluated for seizures and infantile spasms. Every time they laid him on his back, he would go into an uncomfortable spasm. He couldn't sleep. The parents were terrified to even change the diaper. Multiple neurological specialists said the spasms would most likely get worse, and they had recommended to go to the next step, which was a hospital EEG. Now, the parents waited for weeks for this appointment, and they actually found us on social media. They found us for the individual neurological insight scans. Braxton's scans showed that there was nervous system dysfunction and a very stressed and dysregulated body. The stress was locked up in fight or flight mode, and it couldn't calm and it couldn't coordinate communication. So the difference is that these scans aren't used just to add another diagnosis to the equation. They are used to identify the real root cause and why the nervous system is in a stressed out situation. Now, just after 1 week of gentle, very specific adjustments, little Braxton had no more spasms, not a single one. Mom described him now as calm, happy, he sleeps perfectly. And when they actually went to the hospital for the EEG 4 weeks later, it was completely clear of seizure activity. Braxton was thriving, and the doctors were just like, okay, well, looks like we're good to go here. Have a great day. Traditional medicine misses a lot of different focuses outside of a crisis situation. They're focusing on signs and symptoms, very obvious pathology, but they completely overlook function. So what they need to understand is why the body is not functioning properly. So your doctor will run blood tests and they're looking for disease markers. They're going to order an MRI to find out structural problems or very obvious pathology. An EEG will search out and understand seizure activity, but all these tests have the same questions. Why is something seriously damaged or diseased? And the problem is that nearly 1 in 12 children in this country has a speech or a language condition. The vast majority of them have completely normal blood work, normal MRIs, normal EEGs, and they have nothing wrong medically. But these tests are missing what really matters, is that the nervous system's role is coordinating body function. So your pediatrician's height and weight measurements on charts are important. They focus on growth, whereas the Insight neurological scans assess whether the management and growth of the immune system, digestive system, sleep, and behavior are coordinating properly through the nervous system. Because this system is the air traffic controller for your child's entire body. When they're stuck in stress mode due to prenatal stress, birth trauma, early developmental challenges, this gets out of sync. Now, the Insight scans give us a different understanding of how your child's nervous system is performing. So the neurothermal scan, it shows where stress affects digestion, immunity, organ function, and it helps to explain symptoms like reflux, constipation, ear infections, and frequent illnesses. The spinal EMG gives us an understanding of muscle tension within the spine and nervous system. It helps to explain developmental delays, sensory imbalances, focus problems, and coordination issues. The HRV scan shows us how well the nervous system adapts to stress, and it explains issues, transitions, emotions, sleep, where their nervous system is stuck in overdrive. We put these three scans together and it gives us an understanding of neurological dysregulation. Now, there are some similarities that we see in kiddos, and one of the most important ones is the EMG scan, which really reveals specific stress patterns that can contribute to a lot of struggles. So we see the raging bull, which means that the nervous system is stuck in overdrive. It shows up as anxiety, hyperactivity, behavioral issues, or poor sleep. Their system just can't shut off. Whereas the drunken bull shows poor coordination, poor organization within the nervous system. And it leads to focus issues, low muscle tone, sensory struggles, and learning challenges. Now, these patterns usually come from a perfect storm of early stress. Prenatal stress, birth trauma, early injuries and illnesses, antibiotics, and ongoing environmental pressure that stacks up over time. Research shows that kids with more than 6 rounds of antibiotics before the age of 3 face a significantly higher risk for allergies, asthma, and gut issues because those early stressors compound and lock up the nervous system into dysfunction. Now, the good news is that kids aren't stuck like this forever if their nervous system is restored and balanced. And that's how health and development works, is that the body is designed to be self-healing and self-regulating. We just need to identify and remove where the interference is occurring. Now, the insight scans replace the guessing with objective data, and they show exactly what's happening, and we can track exactly how the child is healing, not just based off of improvements from what the parents tell us, but objective improvements throughout the scans. Therapy can feel like pushing a car up a hill with the brakes on. You're doing everything right, but the progress is slow because the foundation, which is the nervous system, isn't quite stable. So when the scans show stress that is stuck with certain patterns in the nervous system, like dysautonomia, it explains why therapies stall, and it shows exactly what we need to do to fix it. When you restore this imbalance, then therapies start to work better. Parents can see changes in sleep and digestion and the immune system, and usually within a few weeks, we can actually see with the reassessment of new scans, the objective improvement in balance. So if you're tired of hearing just wait and see, watch and wait, collecting a diagnosis, and you're looking for real answers, these insight scans are the first step in the right direction because they identify where the imbalance resides within your child's nervous system. And they can improve more than just taking medication, and they really do deserve to have their nervous system functioning at its full potential so they can actually thrive in life. If you click on our link below or send us a DM, we'll send you information on how to arrange a consultation with me. We can go over some of the concerns you have with your child's health. We can clarify how this office, Maximize Chiropractic in Sacramento, can serve your child's needs so we can get their health improved and we can really help their bodies thrive in the future.